What is up, sapiosexuals? Welcome to Sex Solutions, where everybody comes for happier, healthier sex. So the solution that we are breaking down today is how to make a penis bigger. I'm not just talking about longer, I'm talking about wider. You heard me, girth. We want to see if we can make the whole penis bigger because you know what? That is a huge problem that affects so many men's self esteem. Even the average size of an erect penis is actually just 5 inches or under, as in 96% of the male population has an erect penis that measures 5 inches or less. It still has a lot of stigma attached to it, which makes men feel bad if they just don't have this ginormous penis. So today we are breaking down how to make a penis bigger so that men can get over their self-esteem humps and have confident, amazing sexual relationships. And to help us untangle this tiny, not so tiny situation, I brought the expert in, the man, Dr. Tory Sullivan, board certified dermatologist. He went to Georgetown undergrad, did his medical training at Vanderbilt, and his residency at the University of Miami Miller School of Medicine. Dr. Tory Sullivan is on the faculty still of the university, educating doctors from all over the world. I am proud to call him my colleague here. He's also the founder of Get More Girth, a specialty medical practice dedicated to enlarging penises exclusively using FDA-approved dermal fillers. Dr. Sullivan, welcome to Sex Solutions.
Hi, well, thanks for having me, and thank you for that great introduction.
Well, great and girth, a lot of G words we got going on today. I really appreciate your commitment to helping men get more girth. Tell us, what was your inspiration for getting into this line of work?
So it was coincidental. I was sitting in my office having lunch, and a filler rep came by and was just like, "Oh, by the way, guess what somebody's doing?" And immediately my wheels were ticking. It was just very intriguing because, I do filler all day long in people's faces, lips, all sorts of locations. And, that was an obvious location that we weren't in. And so I did some investigation, and here we are talking about it today.
So, Dr. Sullivan, you see men every single day, and they come to you with real concerns about their penis size, and
Yeah.
they want measurable improvement. They don't want gimmicks. They don't want the pills that we see, at 2 a.m. when you're watching those terrible commercials because you can't sleep. So, what do the men actually say when they come to you? Is it that they want to satisfy their partners or that their confidence is low? They don't feel like they're performing well enough? Tell us a little bit about what men say when they come to you.
Well, by the time they've come to see me, they've overcome a huge hurdle. They've had to book an appointment and walk into an office, and these men are kind of a little adventurous to begin with. And so I find they're not shy about telling me why, they're there. And it's all sorts of reasons. So I have to say that I had some preconceived notions about why people may be coming. I think the number one reason is self-confidence. They've always felt less than, or felt that they didn't have what they wanted, and so they want a boost in confidence. I get a lot of men who come that have been with a long-term partner who's changed with time, and they kind of want to recapture, what things were like years ago. And you know what? I have a surprising number of men who have been hurt by a partner who said something that really surprised me. Yeah, I know it. That one makes me feel bad. But the vast majority, it's not from some outside insult. It's from something internal that they want to change about themselves.
Wow, that's interesting. Especially, and it's a little heartbreaking. It's
Yeah,
bittersweet.
on those men, I just really feel like, whoever they were with was probably not a good person to begin with, to be with.
Anyway, right. You never want a partner who's gonna try to make you feel bad about anything on your body. Something especially,
But
I
I can
mean,
imagine it comes up in a fight or not, it was
Right.
designed to wound.
Absolutely. Absolutely. So tell us a little bit about what Get More Girth actually does, because you run a specialty practice, but it's focused on what's interesting, non-surgical
Yeah.
male.
So
So they're not going to the hospital when they come to see you.
yeah. So for many years, there's been a procedure where you can have an implant in it, but it's a semi-rigid silicone implant, and it requires surgery. I think it's not very natural looking. I don't, if you've ever seen one in person, you can definitely tell something was done. And because the implant is semi-rigid, you're always semi-rigid, which can create some obvious problems, if you can imagine. So what we do is just like we do with fillers anywhere. We just inject the fillers along the shaft. So I do that with two simple insertion points, and then I use something called a micro cannula to just thread the filler along the shaft. And I would say one of the number one comments people make after they've had it is they were kind of shocked at how easy it was. They were expecting kind of a longer procedure, more recovery, more pain, and it's really none of those things.
You're absolutely correct. I'm surprised hearing this because, as you know, here at the University of Miami, we used to have a surgical center that actually did the procedures of like making penises for people who were changing their gender.
Yeah.
And so I learned a lot about how to make a penis when we were doing those surgeries here, and it is very, very difficult. And then even after the process, it's like a year's worth of stretching and rubbing and practicing before you can actually even use it in a similar fashion to what someone born with a penis would be able to do. So this is not, I know, like pumps, just to give everyone a little quick and dirty summary. There's penis pumps. So before, right,
Right. Penis pumps.
you go and you pump it up. You stop the foreplay. You're like, look, I gotta pump this up for stop. I gotta pump up my penis. And then there's the injections,
Right.
right? For a lot of men who might have cardiovascular issues, or they can't take traditional Viagra or Cialis to really help with the erections. I mean, those are some what people think are scary things, but what you're saying is this is like an easy, it's an outpatient procedure.
Yeah. So you come in, we numb you up. I do two needle sticks for some local numbing, and then you're completely numb. And then through those same two holes, I use that micro cannula, and I just inject filler along the shaft. And for 20 years, we've been injecting filler in people's faces and different locations in their body, and they're good to go that day with no pain. They don't require Tylenol, and it's the exact same process. And what makes it easier than the process you were describing, where you have to create a penis from scratch, is that we're just adding to your natural anatomy. So we're not changing anything, we're not modifying anything. We're just pumping it up a little bit, so to speak. And the pumps and the injections you talked about, they don't actually make you bigger. The pump will temporarily expand your size, but at the end of the day, when you go to the gym, you're not any bigger, and there's no actual increase in girth.
And I guess for men, that's what really matters, is when you go to the gym, because you guys use the bathroom also in front of other people. And I've heard that a lot about the locker room talk. Everybody wants to look, ladies, we don't have that. I don't get down and look at her vulva and see
No.
mine, or if it's bigger or smaller or more stretched out or something like that. But I know men, it's very obvious when you're in the bathroom, you're in the locker room. People want to look good, and especially I guess at the gym, it's a competitive
Yeah.
space as well.
And for a lot of guys, penis size is a kind of marker for masculinity, right? Like we talk about being big and everything like that, and it's a marker for masculinity. So when people are smaller, they often feel self-conscious. They don't want to change in locker rooms. They're embarrassed about how they're in their clothes, and so that is an easy fix.
Wow, I have so many more questions for you.
All right.
Like, how do they feel as soon as you finish the process? Do they look down and say, wow? But I'm going to hold those questions until right after the break. We're going to come right back. And I want to know about the wow factor right when you finish the injections. Stay tuned to Sex Solutions. We'll be right back after the break.
February 19th to the 22nd. Join your favorite culinary stars at the Food Network South Beach Wine and Food Festival.
It's going to be amazing.
Don't miss out on the gastronomic extravaganza that's making waves.
If you haven't been, you are missing it.
Take part in masterclasses, tastings, exclusive events, and so much more. Proceeds benefit educational programs and scholarships at Florida International University.
And buy your tickets early because they're going to go quick.
Get your tickets now at SoBWFF.org.
To learn more about what we do, to get involved in our mission to help all of Broward's children learn, grow, and thrive, or to find a program or service for your children, visit us at cscbroward.org. Children's Services Council of Broward County. Our focus is our children.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman & Dover Law Firm, youraccidentattorneys.com.
Welcome back to Sex Solutions with Dr. Sonjia. I'm so excited that we have Dr. Tory Sullivan with us here today, and he is an expert in male enhancement. By that, I mean making penises larger. He does it using dermal fillers. It's an outpatient procedure, no surgery necessary. And guys, this is a real doctor trained at Vanderbilt University and did his residency at the University of Miami Miller School of Medicine. The perfect doctor for Miami Beach. Exactly what everybody's looking for down here. So Dr. Sullivan, before the break, I wanted to ask you about the wow factor. So when you finish the injections, what do people say? Like before they put on their pants, are they able to see the difference immediately?
Yeah, 100%. Because when we're done, it's there and you can see it. So a lot of guys are really kind of shocked how easy it was and how much better and bigger it looks. But it does continue to expand for about 2 to 3 weeks. So with especially the HA fillers, what you see immediately afterwards is not what you're going to end up with. You get about 20% bigger. So right when you leave, we bandage you up with an elastic sleeve to help with compression. And I'm certain that the minute people get home, the first thing they do is take that off and check things out. And they're always just kind of shocked at how easy it is. And guys are looking for an inch of girth. I don't know why that number seems to be the magic number. But even a half an inch, a quarter inch really changes dramatically how you look. And the other thing is that it's much more impressive when you're erect. So you really see that it's the same girth change, but it's just really a lot more noticeable. And that's the other thing. I frequently get messages a day or two after that they're just really wowed by the size of it.
Wow, I'm getting like really hot thinking about what I would do if my man came home and showed me his penis and it was just bigger and he was just as excited about it as I was. So you said HA earlier, and what you were really talking about is hyaluronic acid, right?
Right, hyaluronic acid. Like common examples are Juvederm, Restylane, Voluma, Volux. There, I think at this point, 20 HA fillers on the U.S. market, but we use 2. We use Voluma and Volux for 2 reasons. They're long-lasting, so they last about 2 to 3 years, and they also have the correct firmness. So fillers vary in how firm they are, and you want to have something that matches, good for the penis firmness-wise. Unevenness, a little lumpy, some bumpiness, something like that. But that's easily corrected. We either add a little filler, or with the hyaluronic acid fillers, we can dissolve a little filler. And that just requires some follow-up visits. So that is the most complicated or most common side effect. The serious side effects that we worry about are infection, an allergy or some sort of reaction to the filler. And then, of course, the ultimate, most dangerous one would be either vascular nerve damage. And so that is also another reason it's important to go to somebody who's very experienced in the correct techniques. And heaven forbid you have that 1 in a million side effect. They know how to manage you and get you through that process.
Okay, let's talk a little bit about pain, honestly, because we know if men had babies, there would be no children in the world, right? Men cannot deal with pain. So I know you said that there was some numbing involved, but is there any pain after during the
No.
No?
So I tell patients that you should not even need a Tylenol. All right.
Wow.
So, yeah, I mean, a day, for a day or two afterwards, if you touch it, you'll know something was done, right?
Right.
But
right.
remember, it's a very small needle bore that goes in, right? The filler is not painful itself. So I really do not expect patients to need anything more than, I don't even think most need Tylenol. At most Tylenol, if you need anything other than Tylenol, I want you to contact me, because it should not feel that way. And I think that's one of the number one surprises people have, is just how comfortable it is.
Okay. And when people come in, do they ever bring their partners with them and then they pick the thighs together?
You know what? It's a little infrequent. Most people, if they're going to bring their partners, bring them to like the initial consultation to kind of hear about the procedure, side effects, everything like that. And earlier we talked about people who had not said such nice thing, but I think most of the time the partners, although afterwards they're happy, I think most of the supportive partners really aren't looking for that. I mean, I think we see that all the time in cosmetic procedures. Women have breast implants, I think most of the time, not for their partners, they have it for themselves, to feel better about themselves, look better in clothes. So usually they bring their partners for moral support or to help ask the correct questions. But it's usually up to the man to decide what he's going for. I think most women would actually prefer they not mega size it, just something reasonable.
Speaking of which, is it any size? Like, how much bigger could they actually? I'm trying to come up with a model. Like, how much bigger can we get here? Let's say we're talking about a regular, maybe 4.8 inch penis.
So I think you're right on about 4.5, 4.8 is the average erect girth. I think about an inch is I think if you get a half an inch, that's very noticeable. That puts you above average. An inch, if you go to 5.5, you're way above average. Now, I have some men that want to go 6 or more, so they want to get an inch or more of girth. And at that point, I usually tell patients, nobody's going to know you've done anything, but once you're over 6, they're going to know something's different here. And it's very analogous to women and breast augmentation. I think most women, want to just kind of increase what they have, but want to remain natural looking, right? And then, there are some women that want to go really big. And so that's kind of the way with men and penises. Most guys are going for about half an inch to an inch, but I have those in occasional mega sizers. It can get pretty big.
Wow. When we come back, we're tying all this together with hormones, body confidence, and skin and weight. I know that you're also an obesity expert, and we're going to talk a little bit about that, how that impacts size and performance and the procedure. Stay tuned. We'll be right back with Sex Solutions.
February 19th to the 22nd. Join your favorite culinary stars at the Food Network South Beach Wine and Food Festival.
It's going to be amazing.
Don't miss out on the gastronomic extravaganza that's making waves.
If you haven't been, you are missing it.
Take part in masterclasses, tastings, exclusive events, and so much more. Proceeds benefit educational programs and scholarships at Florida International University.
And buy your tickets early because they're going to go quick.
Get your tickets now at SoBWFF.org.
To learn more about what we do, to get involved in our mission to help all of Broward's children learn, grow, and thrive, or to find a program or service for your children, visit us at cscbroward.org. The Children's Services Council of Broward County. Our focus is our children.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Welcome back to Sex Solutions with Dr. Sonjia. Super excited that we have Dr. Tory Sullivan here today, who is an expert in helping men get more girth. Like he is the man in Miami if you're considering enhancing your penis size. Super lucky. Dr. Sullivan, you're also an expert in obesity management and weight oriented types of interventions. And we all know that obesity is a metabolic problem that can impact your ability to become erect. And depending on size, it can have a lot of implications sexually. But has someone ever come in for penis enhancement and you've also needed to do some interventions around their weight before? Or can you tell us, are those ever related types?
Completely related. So, one of the leading, it's known as buried penis, right? Or turtling or a retraction. Men call it different things, but one of the leading cause of acquired or something that happens as you're an adult, buried penis, is weight. So as you gain weight, many men gain weight in that suprapubic fat pad, the fat that sits above the penis, and it just slides down and covers the penis. So your penis is just as big as it was before, but it's just harder to see. And I've had a number of men actually that have come in to get girth enhancement, and we proceeded with that. But the same thing that we did is we worked on their weight. Now we have these amazing medicines, the GLP-1 agonists like Mounjaro, tirzepatide, Zepbound, semaglutide. They have a million different names, and they are just remarkably effective and safe medicines. And I actually have one patient I'm thinking of in particular who it was night and day. And then the bonus is you're healthier, you have less weight, you're more able to have sex. And so that was like a win-win in that situation.
Awesome. And I know a lot of people who are on, you're calling it GLP-1s and you've said all the names, but everyone else calls it Ozempic, right?
Yeah,
even though
right. I think that was the only name I didn't mention.
I know. I was like, just put that one in there, but no. So I know a lot of people who have lost weight on Ozempic are now concerned about loose skin, and now they want to get their skin together. So is there a thing called like Ozempic penis? Do they ever like
you know what? It's all positive for the penis with Ozempic. So there's no downside. You don't get any loose skin. So you can see more of it. You can use it better. It's all upside with Ozempic.
Okay, awesome. And I know not every man needs enhancement. Who should consider it, do you think? And who should work on something else first?
So I think the nice thing about it is it's very safe. So even men who have some health issues can do it. So that's not a big impediment. But I think you should really think about your motivations. So I think that if you want to do it for yourself, if you want to do it to be more confident, right? I think that's a great reason. If you're in a relationship and you want to do it for your partner because you want to do it, not because they've told you something, I think that's a great reason. An analogy I have is that many years ago, as a very wonderful gift, somebody gave me Lasix. They were going to pay for Lasix for me. And I didn't do it for a couple years. And then after I did it, I was like, why? Why did I wait 2 years and be blind? And so I think it's something that if you're thinking about, that if you've thought about it, if you've done those Google searches, you should at least get a consult, explore the option, and see what it would do for you. Women do cosmetic enhancements all the time to feel better about themselves, but there's such a stigma around men doing things. And I think it's just ridiculous. We don't even like to talk about it, but I think it's ridiculous. I think if it's something you've thought about and you're doing it for yourself, you shouldn't hesitate for a moment.
Absolutely. I agree with you. Guys, you know what time it is. It is time for your climax, where we give you some takeaways about enlarging the penis. 1, What I learned from Dr. Tory Sullivan is that penis size really strongly correlates with self-esteem. And I didn't just learn this from Dr. Sullivan. We know this. We've seen, sometimes we see a man who acts like a jerk, and my first assumption is, oh, he must have a really small penis. Ooh. So that when you're thinking about penis enhancement, it could be a pathway to improve your self-esteem, but it's your issue. It's not for somebody else. It's something that you're doing for yourself. And number 2, go to a board certified physician to get this done, because the follow-up care is critically important. In case there is a complication, you want to make sure that there's someone responsible who can guide you through getting on track and getting the most out of your procedure. Really important to keep everything above and beyond. And when I say that, go to someone who's well-trained, who has a great reputation, like Dr. Sullivan. And 3, if it's something that's been bothering you for a long time and it's a personal issue, you don't feel like it's okay to get undressed at the gym, you don't feel comfortable using a urinal next to another man, then pull off the Band-Aid, take the first step, get a consult. It's something that you're doing for you. And doing it can actually be life-changing. Imagine never having to worry about your penis size again. And last question for you, Dr. Sullivan, before I ask you how people can reach you, is how long does it last?
Good question. So I tell patients that it lasts at least 2 to 3 years. I think often they get a longer duration if you're using a hyaluronic acid filler. There's another class of fillers that are called polymethyl methacrylate fillers, and they actually are permanent. So you really have different options. You have, I'm going to call it short term, but it's, at least 2 to 3 years. And then you do have a permanent option.
Wow, that's awesome. Let me tell you, I had so much fun chatting with you today about making penises bigger. And you know what? I've never felt so lucky to be a lady. Dr. Sullivan, where can they find you? What are your
So I have 2 locations. I'm located in Fort Lauderdale, East Fort Lauderdale, and I'm located in North Miami. And you can find me at www.getmoregirth.com.
www.getmoregirth.com. All right, guys, you know where to find me for your daily dose of Nookie knowledge. Check me out on all your socials. That's Dr. Sonjia, DrSonjia on TikTok, Instagram, LinkedIn. Come on, baby. You know you want to link up. Thanks so much for tuning into Sex Solutions, where everyone comes for happier, healthier sex.
Will you be my lover?